All right. Postprandial endotoxemia. Lots of words.
Okay.
So basically, we're just talking about endotoxins, where they come from, how harmful are they? You know, how are they harmful? Like what happens? And what's the
Mhm.
difference between postprandial endotoxemia and metabolic endotoxemia? Because they use all these big words and it really isn't complicated.
I was going, what does she mean by PPE? I'm not
Yeah,
understanding.
postprandial endotoxemia versus ME, metabolic endotoxemia. So, what are endotoxins? Any
Just,
guesses?
I don't know, debris from something. Debris.
Yeah.
Nonsense. Yeah.
Yes, it's
Yeah.
debris from,
Mhm. Bacteria.
bacteria. So both gram-negative and gram-positive bacteria have plasma membranes, and a peptidoglycan layer. So peptide. Don't let all these big biological words scare you because once you know the root of these words, it's really easy. Like I could sit there and go, what?
Hmm.
Peptides are what?
Oh, I forget.
Proteins, amino acids, right?
Proteins. Proteins. Yes,
Yep.
yes, yes, yes.
And glycans, right? Glyco, sugar,
Sugar.
right? So
Mhm.
it's a amino acid glyco layer in their cell wall. So gram-negative bacteria have characteristics that separate them from gram-positive bacteria, and we kind of know that too, right?
Mhm.
So the peptidoglycan layer of a gram-negative bacteria is thinner than that of a gram-positive bacteria, and it has an outer membrane covering it. So the outer membrane contains a fatty sugar layer called a lipopolysaccharide,
Mhm.
LPS, right?
Yep.
Term lipopolysaccharide can be broken into two words, lipo meaning fat and polysaccharide, which is sugar. Within the lipid portion of this LPS layer is lipid A, which is a dangerous endotoxin.
Okay.
Okay? So that's all these fancy words to say there's LPS, right? Which we've learned a lot about LPS. So this is a gram positive. It's got this lipoprotein, the fatty outer layer. Those are the peptidoglycans. And then it's got the space in between. And then it's got the cytoplasmic membrane. Gram negative have two of these cytoplasmic membranes. And it's got one single layer here with the lipoproteins that connect them. And then it's got these lipopolysaccharides on the outside of the outer membrane. And this is just a pore. A porin is just a protein that creates a way in and out. So that's the difference when you're looking at the different
Mhm.
bacteria, how they're different.
Hmm.
And this is just a different view. So gram positive has the single layer, um, the envelope, and it's got these
Mhm.
lipo, however you say that word, teichoic probably.
Mhm.
Um, and it's got the different membrane proteins, the different lipoproteins, but the lipopolysaccharides on this outer layer are on the gram negative.
They look like little buggies.
Don't they? Little hairs growing
Yeah.
out there. Yeah.
Suckers.
Yeah. Looks like, I think of it like stiff, like the 24-hour shadow on a guy.
Yeah.
That stuff is ouchy. Yeah. And that's what causes the problem.
Hmm.
So, some examples of gram-positive bacteria are Staphylococcus aureus, Clostridium, Bacillus anthracis, Strep, Pseudomonas. And gram-negative are the E. coli, the Streptobacillus, Helicobacter pylori. So when you're killing these off, you're going to get LPS versus if you're knocking back some gram-positive that's not going to have as much of the endotoxin, right?
Hmm.
Um, I have somewhere where's my slideshow? Sorry, I have too many windows. Let me look. There we go. Oh, no, that was probably not it. My screen sharing is paused. Sorry.
I'm telling you, Joe, if I don't get out of this job that I'm in, I'm gonna kill somebody.
Don't do that.
Ah,
And that's all right. I just lost all my windows. I stopped sharing, and the window that has my Canvas slides is gone.
I have to be to
This is what
something.
happens when I have
God, I'm
too
not even.
many windows open.
If I mute myself to scream, that's why I mute myself.
Oh gosh. What the heck?
This is why in my world, whatever.
Canva. I have like all these Canva copies here, but it's not. All right, I'm just going to stop share if it's going to let me stop sharing so I can go back and find my slides. That is the one that I wanted to do. There we go. This is the one that has, I had a screen that had notes, and then I had the screen that actually had my slides, and that one is missing in action. So I'm just going to reopen Canva and reopen that slide deck because it's a lot easier than trying to find the one I had opened. What the heck? Someday I'll learn how to do all this stuff and it'll actually,
Oh,
I won't disappear things.
so yesterday on the activator, there was a Dr. Katie and Nicole.
Mm-hmm. How was that?
It was good. It was, well, I mean, it was good hearing some of her ideas on the membership, on how she really doesn't call it a program. It's just flat out membership to make it so people stay engaged. But anyway, the question that Dr. Laura had for her at the end was like, what's your number one technology? Like, what do you like the best with your technology? She goes, honestly, I'm old school. I would much rather paper. She goes, and I'm doing, Google right now, and everyone's telling me that that's kind of outdated, but that's what's working for our practice with paper, just
Right.
documents and things like that. Because, who has practiced better, who can, and there's a lot of information. And she's
There
like,
are. And
400 patients a piece, keeping track of all of this is,
yeah,
but anyway,
yeah.
put technology in a
I'd like
book.
to have that problem. But
Mm.
I think about it though. I shared that Good Money with Kate Northrup, Christine Northrup
Yeah,
stuff.
I gotta listen to it. Yeah. All the
And, you know, talking about, what is sufficient for you? What's your number,
hmm
right? Because your number that fits with your lifestyle is going to be way different than somebody else's. And there's people on there that are making hundreds of $1,000s a year, living in houses that cost that much, that are struggling. They think they're broke. And I go, if I had that much money,
You'd be, yeah.
right? I mean,
Be
I
well.
live in between Buffalo and Rochester in Western New York.
hmm
And up until like pre-COVID, most of the houses around here didn't even sell for 100K.
Yeah.
You know what
No.
I mean? Like it
Yeah.
just was, I mean, I bought my house in 2007 for 45,000. Now it was a fixer-upper and we were like all into that.
hmm
Um, but they had knocked, it was a family friend who they'd been trying to sell, and the living siblings got back together and said, "You know what? We've known you since before you were born. Like we knew your parents when they were little, like our families have been, we're godparents of each other's kids and stuff." And said, we're going to sell it to you for 45. We just want you to have it. I'm like, okay. They took like 30K off of it. And I'm like, sold. It was ugly. It had brown shade carpeting and melon. The walls were painted. In this office, the walls were melon orange.
Interesting.
Yeah. Yeah. It was very interesting.
Hmm.
Like we took paneling down. And I'm like, that is a color choice.
Yeah, you're right. And paneling alone is annoying. And then to have that behind the paneling, I guess they figured, wow, it's going to be a pain in the neck.
Yeah. So I'm like,
That, so we'll
literally,
just
we were
paneling.
like, I'm putting that paneling back up and we're just going to paint the paneling. So a nice calm blue. Let's do that. Oh my gosh. All right. So let's see, where was I here? So from where do endotoxins originate? That's the question, right?
Mhm.
Um, Let me go back. So when gram-negative bacteria are destroyed, either by antibiotics or by our immune system, they release toxins into our body called endotoxins.
Mhm.
So postprandial endotoxemia is just it's literally that. Um, Endotoxins are also brought in with food, right?
Mhm.
How are they harmful?
Well, and just looking at the 5-minute video at KBMO, it obviously does wear down our mucosal lining to some extent,
Yeah,
creating inflammation. It could cross the blood-brain barrier, causing anxiety, joint pain, all of these fun things. So it's inflammatory on
yeah.
the period.
Yeah. So endotoxins stimulate the large amounts of proteins called cytokines. And if you
Yep.
lived through COVID, you heard about cytokines and the cytokine storm, right? Cells communicate with each other via these cytokines. And these particular cytokines stimulate the activation of the immune system. They send messages to the cells to clear the endotoxins. However, when a large number of them are released, it can overwhelm the body, become toxic in and of themselves, and this in turn releases a cascade of inflammatory events, leading to symptoms that can include fever, aches, shock, and even death. And all the things that you said, they can cross the blood-brain barrier, things happen, right? And you end up
Mhm.
in more of that cytokine
If
storm
I left
thing.
that screen open for my daughter who has positive LPS from KBMO, she would think that she's dying tomorrow.
Yeah,
She's just like, am I going to be okay? Am I going to be like, she has no clue the severity of what this could do.
right,
And because she was on a prophylactic antibiotic from the age of 4 months to the age of 2 years old,
right.
um, between the disgusting sugar that they put in it, so the
So they could take
infants
it, right?
will take it to, first of
Yeah.
all, used to fight, have to fight her to get it in her mouth and swallow it. But
Hmm.
um, that's pretty scary. And I again, with all of it, when this came back, and well, after you guys, we had the conversation in the chat in Telegram, I was just like, you're an idiot, Michelle. She was on antibiotics for 2 years. 2 years.
Yeah, and you don't think about it because it's just what you needed to do to get her, like,
Well, yeah, she had renal reflux, so her
right,
kidney couldn't get infected, basically.
right,
Otherwise, she'd need a kidney.
right. Well, and I think about the years I was on prophylactic antibiotics.
Hmm.
And, I talk about, having recurrent bladder infections and recurrent sinus infections and before that I had recurrent throat infections. Never ear infections. Everybody talks about ear
Well,
infections,
that's how
ear
she
infections.
started with the ear infections, and then
And but
yeah.
mine were throat infections. And then I had my tonsils out, right? But before that, I could have, if I was smart and what, my parents were a little bit money better, like I used to get paid for every dose of antibiotics I took. I don't know what I spent the money on because I should have probably just invested it.
You'd be able to
I
go
would
to
have been rich
scholarships
for the
now.
amount of antibiotics I ended up taking.
Yeah.
Um,
But that's, I mean, and you
yeah,
think, but then that's when when babies are developing in their bodies and
yeah.
they've got their mucosal layers that being destroyed now from all this. And she does
Hmm.
suffer with inflammation in her sinuses. She's always stuffy when she lays down. So,
Well, and that's where I ended up. They wanted to tell me that I had asthma. And I'm like, no, I have had no lung issues, no sinus issues, right? I mean, it started with allergies, and then it was, the allergies started with the sinus infections, and then you get antibiotics for those, and then those weren't working, and the antihistamines weren't working. So then I was on two different kinds, and then it was like, well, here's the Flonase and and I want you to use Afrin too. And I'm like, it wasn't until I started sniffing stuff up my nose did I start having trouble breathing. Like, do you think that has anything to do with each other? Oh no, you're just asthmatic now. And I'm like, I'm done. That was the point where I was just like, I am not asthmatic. I'm not going to live my life as an asthmatic. I'm going to stop all these medications you gave me that have slowly made me worse, not better.
mhm.
And I think that was the moment where I stopped trusting the medical system.
Yeah. Yep.
I was like, I'm done. I'm done. So, um, but then I go back to when I read why stomach acid is good for you.
Mhm.
and how the breakdown in digestion and the loss of, you know,
Yep.
good stomach acid creates all these symptoms, can affect B12 absorption. And because of the vagus nerve and
Hmm.
proximity to the lungs and everything else going on, that alone can has a link to asthma. And I was like,
I think
I
I
wonder
picked
how
that
much of
up.
that was me,
Yeah.
right?
Yep.
So, what is postprandial endotoxemia? So, this is our favorite microbiome labs slide, right?
Mm-hmm.
Plenty of good bacteria are gram-negative, and as we saw, LPS is located in the coating of gram-negative bacteria as a transmembrane compound. Um, LPS in the membrane isn't an issue until the cell dies and it's released, and then you can see all these little pieces of LPS floating around. Um, but it isn't until you get so much LPS, right? And it isn't like this is little other bacteria that can come in and grab onto the LPS.
Hmm.
Um, and it isn't until you get so much and you get this gut inflammation and you get the leaky gut that LPS then
Hmm.
leaks through and causes the release of all these cytokines, right? All these messenger molecules, IL-6, TNF alpha, interleukin beta, and causes inflammation.
Yep.
Um, so the act of eating itself makes the gut more permeable, right? Because you've got to absorb the nutrients. So it
Hmm.
makes sense that our body has a way to absorb nutrients. And I think we forget that. Like I've heard it before, but I forget that, right?
Yeah.
So for 3 to 4 hours after you eat, your gut is more permeable. And that's why when we tell people like stop grazing, stop eating all the
Hmm.
time, especially if you have leaky gut anyway, you're just making it, now you just have permanent. And the way it was described was instead of normally you're wearing regular nylons, but when it gets more permeable, it's like you're wearing fishnets,
Hmm. Yeah.
right? And then the holes just get bigger. Um, until the next meal, it tightens back up until you eat again. And if you're constantly eating, then you have that issue. So these damaged areas start with just a tiny bit of mucosal breakdown and then it spreads.
Mhm.
Um, and then you get more destruction of the epithelial cells. It's not just the junctions that are getting tight,
Mm.
that are getting weak,
Rodent.
but you get the actual breakdown. And then LPS enters into the bloodstream, and then it causes more local, and then these go systemic, like you said, right? They cross the blood-brain barrier. You get leaky gut, we know causes leaky brain.
Hmm.
Um, all right. So just want to make the clarification between actually healing this and not just I think a lot of mainstream GI docs go, well, of course your gut's leaky. It's supposed to be. That's how you absorb nutrients. But that's not what we're talking
Right.
about. We're not just talking about that. We're talking about when this gets bad. So plenty of good bacteria are gram negative. I actually wrote this down. Look at that. Um, this isn't the entire lining of the small intestines. They're just small areas. They can grow into separate areas of concern. Um, That's that. So why is PPE worse during eating? During eating, the bacteria die due to acidic chyme, and that acidic chyme bolus dropping into the small intestine, the release of bile, which is a strong antimicrobial, and then bile triggers the FXR nuclear receptor, which encourages the endothelium cells to release their own antimicrobials, and along with the churning and peristalsis, creates a die-off effect. So gram-negative bacteria die and release LPS. And then what happens with higher fat content being an issue? So what happens in this whole section of the digestive system is, so this is inside the gut, and then you have the gut lining, right? And you have the blood and the lymph. So LPS is a fatty acid compound. It's lipopolysaccharide, right? So it does
Mhm.
have that fat, um, just like triglycerides or other fatty acids that are absorbed. And when other fatty acids are absorbed through the gut, they get packaged up in these chylomicrons. And the chylomicrons then get released through the bloodstream, taken up into the lymph, into general circulation. And LPS can travel the same route
Mm.
and get into the body. So LPS is inadvertently picked up. The main reason higher fat increases the grab of LPS is because a higher fat meal is going to increase the amount of chylomicrons that are around. So this is why some people on higher fat diets feel really, really a lot crappier.
Hmm.
So if you've had people, clients that like go on keto or really
Mm.
can't handle a lot of fats, they feel a lot worse when they eat high fats, which, this might be part of the reason.
Mm.
Um, um, so, a lot of times, um, we've heard a lot of people say like coconut oil is terrible for you, right?
Mhm.
Um, but coconut oil has a double effect on this because coconut oil has the antimicrobial properties.
Yeah.
So if it's
Mhm.
killing off gram-negative bacteria, you're going to get more LPS, and then it's higher in fat, so you're also going to get more chylomicrons. So it's killing and allowing the absorption together, which might be why some people don't do
Huh.
well with that either.
Mhm. You're damned if
So,
you
I
do.
mean, you really, this is where I go, when you have the knowledge and you can visualize what's happening and why it's happening,
Mm.
right?
Mhm.
Like these visuals for me were gold. Like to be able to know, oh my gosh, this makes so much sense. This is,
Yeah.
instead of just saying, well, LPS does this, why? Right? Why is LPS such a problem? What is going on? Um, Food stuff itself can deliver a lot of gram-negative bacteria, which is then killed off.
Mhm.
That's how sometimes you can get a lot of it present in the small intestine. Heavy cream is huge, is one of those things. It's like very high fat, has a lot,
Mm.
so things like that. So
So I
what's the
guess that's
difference?
why, I mean,
Go
the
ahead.
KBM consult, the doctors, I
Hmm.
mentioned something about chicken, and she's like, well, even though it didn't come up on her reactivity, she's like, chicken is dirty, one of the dirtier meats. And I guess because of like thinking about that now, of course, I mean, it's less saturated fat, but it could be, you know what I mean? With the
Right.
LPS, it's really more the LPS issue, not a reactivity issue to
Right. Well, and
food.
that's, it's the same reason why we tell people that don't come up with dairy sensitivities, if they come up with gluten sensitivities, right, to
Mm-hmm.
use both,
Mm-hmm.
and
Yeah.
vice versa, right? You just want to eliminate all the things that are going to trigger the immune system to be more hyperreactive,
Mm-hmm.
right? So when we're in healing mode, take out the high
Yeah.
inflammatory foods. Take out, I mean, even if we did a whole thing on histamine, even when you're talking about low histamine diets, right? Taking out the foods that might trigger a histamine reaction. Even if it's not a food, even if it's a food that you're like, oh, this is a good food. Spinach, avocados, they're great foods.
They're high.
But if they're going to just add to the burden of the body, right? Nightshades, like is eliminating them during those high histamine seasons can help because they're highly histamine creating foods, chocolate, right? Things like that. It's probably why I felt super achy after my gluten-free but high dairy Italian lasagna meal on Easter.
Yeah.
Everything had cream in it. Everything was high
You only
fat.
live once.
Oh, so. Hey, but it was all gluten-free. It was really great. So metabolic endotoxemia is enacted once the LPS has entered into the bloodstream. So postprandial is before it's taken up. And so it's what's happening in the gut, in the lumen. But once the LPS is in the bloodstream, now you've crossed over to metabolic endotoxemia. It starts a potential inflammatory cascade similar to sepsis, and every time we eat, it acts like a mini sepsis. So, what are the clear clinical manifestations of metabolic endotoxemia? And it's the same things we're going to see in metabolic syndrome, right? Heart disease, problems with lipids, hypertension, type 2 diabetes, dementia, cancers, PCOS, and non-alcoholic fatty liver disease. So the same things, and it mimics, right? They all have very similar etiologies and they all start the same way. So what is, so when we got, these are some of the questions that came up in the discussion when I was listening to the other recording, and it was definitely some of the things that we were talking about. That she was going to be talking about in the next few slides, which I have, which is going to be all about bile. So,
Mm.
so much fun. So what's the difference in diets containing fat, um, versus ones that aren't so, ketogenic, carnivore versus having a, low fat, like vegan diet? Is ALP low due to LPS amounts? What about TUDCA and LPS? And where does the LPS go once it's taken
Mm.
up? Like what happens to it? So those were all questions that were going to be answered in the next slides. Um, and then the other thing that the other one that fits into this, and I wish I could just like instant download again, but there's a whole one on migrating motor complex. So is the migrating motor complex triggered by our digestive juices? Is it a function of the body? Like a muscle flex, is the MMC flexing to get nutrients down from the stomach to the large intestines? Um, is the MMC influenced by magnesium and potassium? Why should we wait 2 to 3 hours to eat? What is it
Mhm.
about the MMC that restarts when we start eating again? And if food and nutrients haven't made it all the way through, they sit in the gut, which can cause gas because it becomes over fermented, um, because bacteria are feasting. So that was part of the question, like some of the things that we're going to be going over in the next